One of the interesting things in the world of bacteria is there have been almost no new developments in how to fight them. And all these chemicals that we use, they're antibiotics. Overuse has led to resistance, and Dr. Maresso has the coolest stuff going on, which is these viruses that actually attack bacteria. So can you tell us about what they are and how they work?
Sure. So as Joe mentioned, we've gone through this terrible time with a really bad virus, and I think it's created a stigma where all viruses are bad, and most are, but there's a certain type of virus called a bacteriophage, which infects only bacteria, and we have adapted these viruses to be able to address the problem you mentioned of antibiotic resistance, because largely pharmaceutical companies have gotten out of making new antibiotics. Bacteria evolve very quickly, and so companies don't want to invest in chemical structures that are destroyed within a month of introduction into the market. But viruses adapt, as we've seen with the COVID pandemic, very quickly, right? As the Delta variant arose after a while in the human host. The same is true for these bacteriophage. And so we've developed a program in the laboratory to be able to evolve them to better target certain bacterial strains, and then created a pipeline where we can make them safe to be able to put them in people that have no options for antibiotic therapy.
And you've had some successes, right? There was a paper I read of yours that was taking a patient who had bad urinary tract infection.
Yes, in this case, a clinician in California came to us and said we no longer have antibiotic options for this person. It was a UTI plus a prostate infection, and they thought this person was not going to make it because the bacteria were going to spread to the blood. And so they sent us their bacterial strain, and we screened our library of good viruses for ones that kill that strain, and then we made a cocktail of them so that resistance could not develop, essentially cutting off the ability of the bacteria to become resistant. The patient received the treatment and had a really good outcome, and since then we've done 12 of these.
Wow.
And
That's
we're
awesome.
in the process of potentially in the next year to exceed 30, because we have about 40 in the works.
And how do? You grow it up here, you grow the virus here, and then how do you give it to the patient?
So the first step is we need the strain. So if a
Right.
clinician has a strain and there's no antibiotic options, they could send it to us. We created a program to be able to receive the strain.
And we love getting bacterial pathogens that there's no cure for here at Baylor College of Medicine.
Absolutely.
Yes, because we also sequence them and learn why they're bad.
Yeah.
So the first step is to identify good viruses that will hit the target pathogen. And then after that, we have an amplification program to grow a lot of it, because a lot of it is needed to administer to the patient. And then we have a third program where we make sure that what is actually going to be given is safe. So is it sterile? Does it have toxic elements, etc., that may be carried over from the purification? And so we're trying to create this pipeline that is really the first in the world to be able to do this. And I think we're the leader in the world.
How do you give it? Is it IV?
It's a clinician call.
Oh.
So depending on the type of infection, most of these are given, because these patients are pretty critical.
Right.
Most is given through like a PICC line or through an IV. Intravenous is desired at the moment, but we have topical treatment too. We've done external treatment of catheters and LVAD devices, and then also direct injection into the site of. So sometimes bacteria the host walls off an infection, and the antibiotics can't penetrate, and we've injected these phage directly in the abscess or in a peritoneal sort of walled-off granuloma to get phage right in that site, and that's worked too. So.
Well, this is it's great. I mean, this is really, just so everybody knows, this is revolutionary. There's nothing like it, and it may revolutionize our ability to treat bacteria without antibiotics. So very exciting work. Really glad you guys spent the time to tell us about it.